October is Breast Cancer Awareness Month. The American Cancer Society reports Black Americans have a 31% higher risk of dying from the disease than any other. Nija Hood tonight tells us more.
For me, I went in like a warrior because I can do it. But to watch my family go through it with me, it's hard. It's really hard.
Tanya Jones was diagnosed with breast cancer in June of last year.
I felt a lump in my breast and I was really concerned about it. And so I went to the hospital to try to find out what was going on.
Even though doctors told her she needed a mammogram, her Medicaid didn't cover it. A year later, after getting new insurance coverage, she took matters into her own hands.
I went ahead and scheduled a mammogram myself. I went and did it myself. I was no longer going to wait for anybody else to have my health or my life in their hands. You know, I had to do it myself.
Many women do not have the same option. Coleman reports among uninsured women ages 50 to 74, only 35% have gotten a mammogram in the past 2 years. Experts say accessibility to health care plays a large role.
In certain areas, you know, they may not have the 3D mammography where they might have it in another area, and you may not be able to have transportation to get there. So that differential in access can really play out, and it really does drive a lot of the disparities that we see.
Keisha Wirtz says she was diagnosed in February of last year, but now is cancer-free. She says she found out the year she missed her annual mammogram.
Just being a typical woman saying, okay, I'm going to do it later, and it never gets done.
She's not the only one. Researchers at the University of Maryland Comprehensive Cancer Center report 13% of Black cancer patients have missed their appointments.
Many times that delay can really lead to, again, a later diagnosis of breast cancer, and the later the stage of diagnosis, many times it might be more difficult to treat that cancer.
Wirtz says this Breast Cancer Awareness Month for her now has new meaning.
You know, I wasn't the one that would do the examination for myself, but now I do. And it means a lot. I never thought it would mean this much, but it means a lot.
Now she's proud to be a survivor.
If you ever come across and they say, well, you got breast cancer, it is a chance of a survival. I am a survivor.
In Columbia, Nija Hood, News 19 WLTX.
Well, tonight, the American Cancer Society says women ages 40 to 44 should start getting annual mammograms, and women 55 or older should get them every couple of years. There are some early warning signs to be on the lookout for. Take a listen.
The most common sign and symptom is going to be a new lump or mass, but certainly if you notice a change in the shape of your breast, swelling of the breast, also any change in the texture of the skin, so redness or dimpling, or any dry, flaky skin that's kind of continuing on, nipple inversion or discharge, that's not breast milk, and then if you notice a swollen node under your arm or around your collarbone, those are things you should be pointing out to your doctor.